So these measures, these broad measures, sound epidemiologically very sound, but we're in a situation where, for example, last week the Supreme Court blocked the president's vax or test measures for companies over 100 people. Dr. Gounder, how do you face the sort of political realities as you talk about what's, as I said, sound like very epidemiologically sound measures?
I think that it's clear that we're not going to hit 85, 90% of the population vaccinated in the US anytime soon, if ever. And so that really hammers home that although vaccines remain our number one, number two, number three most important tools in our toolbox to combat COVID, we really do need to be looking at other measures and employing those at greater scale. So that includes many of the things we've talked about. Making more use of rapid tests so that people know when they're contagious, when they're a threat to others. Increasingly, those rapid tests should also be used to help get people on treatment. So drugs like the new Pfizer Paxlovid drug, which will be available more widely in the coming months. Those drugs could be game changing, but people need to have easy, quick, free access to testing that then channels them, links them to treatment very quickly. And then finally, as Zeke was saying, other measures like ventilation and air filtration, which are really important because they do not rely on individual behavior and can also be a place of public-private partnership to scale up those kinds of infrastructure improvements in public buildings and elsewhere.
Can I
So,
just
Dr. Manuel,
emphasize one?
yes, I want to follow up
Sorry,
with
can
you.
I
Go
just
ahead.
emphasize one thing that Celine was exactly in what she said, but just to really put it home. The best way to protect kids under 5, to protect the immunocompromised, is to disseminate vaccinations throughout the population and bring the case count and the circulating viruses down so that there's a lower chance that those vulnerable groups will be exposed to virus. We're not getting to zero, we're reducing the risks. And that, I think, is a very important psychology. Parents who, in the past didn't obsess about the flu, they just went on their business. When we get down and there's not that much COVID, it's not going away, but it's present at a much lower level. And the people who get it don't get hospitalized or die at a very high rate. That actually should allow us to get to a new normal and allow parents to ease up. And the best way to get there, again, is vaccination and reduce the ambient rate of the coronavirus circulating.